All right, welcome to The Explainer. Today we're going to talk about something pretty wild. AI becoming a constant presence right at a patient's bedside. We're going to break down a real-world system to see exactly how this tech works and, what it could really mean for the future of all of our healthcare.
So let's just jump right in with a huge question. Could an AI really be your 24/7 health guardian? I know, it sounds like something straight out of a sci-fi movie, but the tech to make this happen? It's already here. So let's dive in and see exactly how it all works. Okay, so our journey starts inside the hospital room. We're going to look at a specific case study that really shows off this new frontier. Think of it as a kind of digital assistant for, well, everyone, both the patients and the medical staff.
All right, the system we're digging into is called the Healthflow AI Agent. Now, at its core, it's a solution that uses what are called IoT, or Internet of Things, sensors. Just think of them as smart, connected devices all around the patient. Their job is to watch over patients in real time, analyze all that incoming data, and, this is the key part, send out alerts before a small problem becomes a really big one.
Okay, so what can a system like this actually do? Let's break down its main capabilities, and we'll start with the foundational stuff before we get to the more interactive features. So, the absolute bedrock of this whole thing is continuous monitoring. And look, we're not talking about a nurse coming in to check your vitals every 4 hours. No, this is 24/7, non-stop tracking of your heart rate, your oxygen levels, your temperature, you name it. It's all done through those smart IoT sensors. And this really gets to the main goal here, being proactive, not reactive. The AI is just constantly sifting through that ocean of data, looking for any little pattern that's out of place. The most important thing to get is that it's designed to flag a potential health risk and shout out to the caregivers before it turns into a full-blown crisis.
But you know what? It's not just a silent guardian angel. This system is all about communication, and it does it in a few really cool ways. Patients, or even their family members, can just ask for health updates using their voice, or they can get quick answers from a chatbot. And for the doctors and nurses, they get this one, clean, unified dashboard where they can see everything that matters in a single glance. Of course, right? None of this works if the data is junk. Garbage in, garbage out. That's why a massive piece of this system is all about data integrity. It has these automated checks running all the time to validate the sensor readings, spotting any weird inconsistencies or maybe even a sensor that's on the fritz. It's all to make sure that every decision is based on solid, reliable information.
So we've got all this data being collected and triple-checked, but how do you turn a constant stream of numbers into something a doctor can actually use to make a decision? Well, let's look at the AI process that makes that magic happen. It's a pretty straightforward 4-step process. First, step 1, it just collects all the raw data from the sensors. Then, step 2, the AI comes in, validates it, and starts analyzing it for those really subtle patterns a human might miss. Step 3 is the big one. It turns those patterns into what we call actionable insights. So for example, it won't just beep and say oxygen is low. It's smarter than that. It might flag a slow, steady drop in oxygen over, say, the last 30 minutes and suggest that could be a sign of respiratory distress. And then finally, step 4, those super specific insights are what help doctors and nurses make faster, better informed decisions. And you have to understand, this system doesn't operate in a bubble. A really key concept here is this idea of a connected healthcare ecosystem. Basically, it's built to plug right into everything else. Wearable trackers, the hospital's existing record systems, you name it. It creates this one big, unified environment where all the information can just flow smoothly to where it needs to be.
Okay, so the tech sounds really impressive. I get it. But what about the results? This is the prove it moment, right? Let's get into the actual numbers and see what kind of impact a system like this can have.
Because remember, the whole point isn't just to have more data, it's to get better outcomes for patients. So let's look at the real-world impact in hard numbers. Okay, first up, and this one is absolutely critical, response time. We're talking about an 85% improvement. Just think about that. In a medical emergency where every single second counts, like a heart attack or a sudden decline, slashing the delay by that much, that can literally be the difference between life and death. It's a total game changer. Next up, we have accuracy, and the reported rate here is 90%. Now, this is so important because it tackles a huge problem in hospitals called alarm fatigue. You know, when so many alarms are going off all the time that staff start to tune them out. Well, a 90% accuracy rate means that when this system sends an alert, the team knows it's for real and they need to take it seriously, right now. And finally, let's talk about efficiency. we're looking at a 70% gain in operational efficiency. And this is not just about saving the hospital money. It's about freeing up our amazing nurses and doctors from the tedious, soul-crushing work of manual data entry and charting. It lets them spend their time on what they were trained to do, what actually matters, solving complex problems, providing hands-on treatment, and actually talking to their patients.
So when you put it all together, the tech, how it works, and these incredible results, what does this all tell us about where patient care is heading? Let's zoom out and look at the big picture.
Look, the most important takeaway is this. We are witnessing a huge shift away from the old model of just doing periodic manual checks. We're moving to a new model of continuous, intelligent oversight. It's a fundamental change from reacting to problems after they happen to proactively anticipating them with a huge assist from AI.